Welcome back to Great Day. Time to put a smile on your face beside the fact that Van Halen's debut album was released on this day.
That'll do it.
Dr. Stephanie is here, and we're going to talk about something that it's going to happen. Chances are it's going to happen to everybody at one time or another. Hopefully not, but you always have had something like this happen. But what do you do when all of a sudden something happens to your teeth? And you need something done.
Yeah. Well, it's funny. I had a lady yesterday that she said, "I'd rather have 7 children than have a toothache." You know, it's true. People tell me that all the time. And, you know, women are pretty tough when it comes to pain usually, and they say that I'd rather have a baby than have a toothache. So,
and they usually
all the time.
Your toothache or something happens.
Never had a man say he'd rather have a kidney stone than a toothache, though.
Probably not.
No, probably not.
No, but usually when you have something dental-wise that happens to you, it usually comes after the offices are closed or on the weekend.
Yeah, it's Murphy's Law of toothaches. It is, yeah.
So what is the protocol in case something does happen?
You know, it's really about just knowing, I mean, like, having a relationship with somebody that you know that you can call. You know, our office has an emergency number that you can call all the time, but you have to be a patient of record. You know, I mean, like, you can't just randomly call and say, hey, you know, I have a toothache and I haven't seen anybody for 10 years or whatever. So I mean, you know, it's not that we won't sometimes come and see somebody that isn't a patient of record, but if it's a little easier for us after hours.
You need to be in the system then.
Yeah, I mean, it helps just because it's, you know, we know you, you know us, we have a record, all that kind of thing. So, but it's very much a thing that does happen to people after hours, and it's too bad because it hurts, you know. I understand. I mean, trust me, after 20 years of people telling me that they'd rather have a baby than have a toothache, I get that they're telling the truth. So, I mean, I think the biggest thing is that, you know, what constitutes an emergency, kind of if you feel something coming on,
right,
you know, don't put it off, because a lot of times then it will get to be Friday afternoon and, you know, but we try and see most emergencies same day. I mean, you know, so if you call and you're in pain or you're swollen or something like that, that would be a true emergency, then we try and see everybody the same day.
What's the most common thing people call about when it's an emergency?
I mean, like an abscessed tooth or something.
What's an abscessed tooth? What does that mean?
It means that the nerve inside the tooth has died, and it actually, the infection then kind of goes up through the root and into the bone, and so people will get like a pounding, you know, either up or above or below the teeth. They'll get kind of like this pressure pounding, or just like solid pain, you know, where it just, the pressure just builds up.
And that's from the infection.
Remember in Castaway when Tom Hanks had to bust his tooth out with a rock? That's it.
Yeah, hopefully you're not stranded on an island. I mean, that would be worse. Yeah. So, but yeah, so infection.
So what has to be done in that particular situation?
Usually either a root canal or the tooth needs to come out, depending on the situation.
So you'd have to do that right away?
Yeah, usually we'll do that same day if we can. Or, you know, I mean, the lady that said she'd rather have 7 babies yesterday had a root canal yesterday. So
there's going to be time between when, especially if you're a guy, when you're finally smart enough to call for help and you get help.
Or your wife sends you.
What can you do in that time to make yourself feel better?
You know, I mean, obviously, ibuprofen or Tylenol, you can alternate those two. I mean, over-the-counter medications, people say only get them so far. So really, the definitive answer is to treat the tooth. You know, the source of the infection is the tooth. So either go up through the tooth and do the root canal, or we take the tooth out to make you feel better. So I mean, ultimately our job is to make you feel better, but I mean, again, you have to have a relationship with somebody before that. I always tell patients, I realize, I mean, like, going to the dentist is not anybody's favorite thing, and talking about pain, I'm sure a lot of people just, hopefully they didn't just switch the channel or something like that. But I mean, it really is about just trusting who you go to and knowing that they're going to take good care of you and that they care, you know. So.
Now, whenever you mention stuff like this, Tiara, I'm glad you mentioned that. You said if you have pain, what type of medication do you recommend?
Yeah, ibuprofen or Tylenol.
Now,
like
why do you mention those and not mention...
They're better anti-inflammatories.
Than an aspirin?
Aspirin is okay. I mean,
See,
I don't think it really works quite as well.
That seems to be the more common thing for us old people, is you want to you immediately go for the aspirin.
Yeah, Advil has been out for a long time now, so I mean it's a better anti-inflammatory. It's better for pain. It does work better, and naproxen is even a good one too. So,
that would be your...
so like what's it called? We call it naproxen. I'll think of it. Aleve, thank you. Sorry.
Okay, sorry about that.
You can't test my brain that way.
Maybe a dumb question. Where do you draw the line if you've got a serious injury of some kind between going to a dentist and going to an ER?
Yeah, that's a tough one. I mean, if you actually have like a, if your part of your face is hanging off, I go to the ER.
Right.
If it's just an injury to a tooth or something like that, then I would go to a dentist.
Gotcha.
Yeah.
Okay.
Yeah, I know. You've got kids that probably fall down.
They fall down all the time.
Yeah, same here. I know. I'm shocked that my kids still have their teeth intact.
But that is something that can be taken care of at the same
Yeah,
time. You mentioned
absolutely.
that a couple of different times.
One of the advantages, we have a big office, and so we have multiple doctors, and we have 5 dentists, and so we are able to fit people in a lot easier. So we have people call all the time that have another dentist, during the day, during the week, and they say, I can't get into my dentist for a couple weeks. Can you help me? And I think that's one big advantage of having multiple doctors, and we're able to fit people in because we just have a big office.
Now, would that be something that if somebody might want to come over and visit with you and then get onto your system?
The thing is, there's more and more research all the time that shows that there is an oral systemic connection, which means that your mouth is connected to your body in a way that the health of your mouth is connected to the health of your body. So for long-term health, we really need to be taking care of the mouth as well. And so that means regular cleanings, it means regular checkups, it just means like letting somebody check out, just like you would go in to have your heart listened to have your regular screenings at your doctor, your regular screenings at your dentist. Even if you're terrified of the dentist, just come and sit and chat, but before you have the pain, or if you feel something coming on and it's tender or sensitive and it isn't waking you up at night yet and it isn't causing like a major problem, come in before you have the major problem, because we can fix it a lot of times beforehand.
And there were a lot of people that wanted an excuse to make sure you come over and see your facility, because we've been talking about this for a while now. This might be a good opportunity to go in and see what you have to offer.
Yeah, a lot of times people kind of say, they break a tooth and it doesn't hurt, and then they don't come in until it really hurts, and it's kind of a bad idea. It's something that you really should kind of, if you break something, it's probably a good idea to come in. And if you haven't been for a long time, we just don't, we're used to that. That's normal for us. So
don't be afraid.
Don't be afraid. Yeah. Yeah.
All right. Tell everybody where they can find you.
Yeah, we're on Jordan Creek Parkway, right by Culver's, as a matter of fact, and we're kind of by Lutheran Church of Hope. And the easiest way to find us is dmsmiles.com.
That's perfect. Yeah. Wonderful. Well, thanks for making it in this morning.
Thanks. Yeah.
Okay. Have a safe trip back. Okay. Thank you so much.